Hello everyone, my name is John Del Rossi. I'm a physician assistant with Liquid Beauty in Huntington Beach, and I want to welcome you today to our virtual event to talk about the new exciting group of fillers from Revance Therapeutic called RHA. So why these fillers are exciting, these are the first hyaluronic acid fillers that have been approved for dynamic wrinkles and fold on the face.
Hey everybody, we wanted to remind you to stay with us after the presentation for a little bit of Q&A. We're offering our attendees a special promotion. If you buy 2 RHAs, you'll receive 1 for free.
First, a little education on what hyaluronic acid is. This is something that we normally have in our skin that helps provide structure, volume, and moisture to our skin. Unfortunately, as we age, these levels go down, which gives the aging face look that we want to avoid. Things start to sag and don't look as voluminous as when we were in our 20s and 30s. Now, what's exciting about these fillers and why we brought them into our practice is because these fillers actually most closely resemble the hyaluronic acid that we have in our face. Revance Therapeutic has mastered the manufacturing process to put in very few additives, as little as necessary, which is why it allows them to actually make this filler to be most closely resembling that which we have in our face normally. Now, why I like this as an injector, when my patients come in, one of the things they'll tell me is that they want to look good when they're at rest, but when they have movements in their face, sometimes the older fillers that we have makes them look stiff or not natural. So what's good about these fillers is that because they so closely resemble the hyaluronic acid in our face, that when a person makes expressions, the filler should look very natural to what a person would normally have. So there's no stiff looking appearance, no unnatural looking appearance. And that's really important because I see that with patients, particularly when they do the nasolabial folds or they do the smile lines in this area here. Looks good when they're at rest, but when they make an emotion or they make an expression, they can sometimes see the filler in the areas, and we don't like that. So these present a really good alternative to get a very nice natural look with expression. So the RHA collection has 3 distinct fillers, RHA 2, 3, and 4. Each of them will serve a different purpose on the face, so it's really up to the injector and the patient to evaluate when they meet each other to talk about what area of the face that they're looking to address for improvement, as well as the age of the patient and what their skin elasticity and trigger is like. So we may choose different numbers of fillers, whether the 2, 3, or 4, again, depending on the patient's characteristics. The results that we see from these fillers are immediate, but like with any type of filler, we always tell our patients for the first 48 hours or so you may see some swelling from the needle injections or from the cannula injection. And like the same with any other filler, we tell patients that we shouldn't work out for about 24 hours, don't apply any makeup or any other type of topical agents for at least 4 to 6 hours after the injections. And these fillers are reported to last for up to 15 months. Clean her up here before we start. I'm going to have you smile one more time. So what I'm trying to improve here is the look of these lines when she smiles. Okay? We want it to look natural when she smiles, not too stiff, which is why I like the RHA series, because it will move with her muscle movements, with the dynamic movements of her face. Okay, relax. And your head back. One more puff of the Pronox. Pronox we use for patients who have anxiety related to the needle sticks. Helps calm them down. Doesn't really reduce the pain, but reduces the anxiety related to getting your face stuck with needles. Okay, I like using a vein finder to reduce my incidence of bruises. Okay. And I use a cannula for 99% of my procedures. Ready, dear?
Mm-hmm.
Okay. So I have the cannula inserted, I'm just going to start laying some light threads in the nasolabial fold area. And I don't want to make these lines go completely away because I think a patient needs to have some demarcation in this point. And smile first. Okay, it's a minimal reduction, so she looks a little bit less wrinkled on this side than she does on this side here. Okay, but I want to make sure I have enough here. I'm going to do all the areas, and I'm going to actually kind of wing around here and use the same insertion point. Okay. So all I'm doing now is just laying some light threads right by her marionette lines. And I'm essentially kind of in the mid dermis as I'm doing this. And I'm going to lay a little down right here by the oral commissure. Okay. This side's done. You can already see it rest first. Let's see the rest portion. Just relax.
Oh, I'm sorry.
Yeah. So we can see the difference already. How less visible this line is over here. And then smile. And we can see with even smiling, she has less wrinkles on this side than this side. Okay, so we have half of our model's face completed. We did the right side, we're going to do the left side now. Okay, we have the cannula inserted. I'm going to move into the area of the nasolabial fold and just lay a few threads down. Just making sure I see symmetry on both sides. So again, with the RHA collection, the goal of this is we want to give her some improvement while she's at rest, okay, which we do definitely see improvement, but also we want to make sure that when she has movement in this dynamic muscle, that we want it to look very natural. So smile for us. And relax. And there we have it.
Just want to say thank you so much for joining us and watching the video. We'll also be answering any questions if you have any for the next 10 to 15 minutes. Be sure to write in your questions in the question box below.
And check your text after the event and reply yes in order to book a consultation with our office regarding the new RHA collection.
All right, just a few minutes. They're going to be joining us for the live Q&A.
Hi, everybody. Thanks for joining the question and answer session. We do have a bunch of questions, so we're going to start from the beginning. So one of the first questions is, who's going to benefit the most from receiving RHA? So my answer to this question would be anybody who has wrinkles that are dynamic, meaning that when you make muscle movements in the face, if you see the wrinkle, either worsen or, or in general, they'd be a candidate for the RHA filler. I think all of us would probably agree that, when we make muscle movements, we see wrinkles in our face the older that we get. So technically, really anybody would benefit from this. Who would benefit most is really a subjective question, because my idea of what would be most improved might be different than someone else's idea of what would be most improved. So the other thing, I think those who want a filler that would last a little bit longer of a period of time, because these are reported to last up to 15 months. So if you've been doing fillers and you see them going away 6 months, 7 months, 8 months, this might be a great alternative. A couple of questions, actually a lot of questions I'm getting are for cost, and the cost of these fillers are $700 per syringe. Is it common to do only one side of the face, somebody asked. That's not uncommon at all. So none of us are born symmetrically. So I do, treatments pretty frequently where I might do a little bit more on one side of the face versus the other. Sometimes I do one side of the face and not the other. So it's really, dependent on the person. But I can tell you that no one's born symmetrical. And we try our best to make everybody look as symmetrical as possible. I always joke with my patients saying, look, our creator did make us symmetrical when we were born, and we're not going to do it either. But we're going to try to give you, two sides that look like they're really close sisters. Twin sisters are probably not possible though, okay? Another couple questions, how much is it to do the marionette lines on each side of the face? And that's really going to be dependent upon each person. So my best answer for that would be we'd have to do a consultation on you to see how much you would actually need. I would probably think that you wouldn't need any more than one syringe though to do it, but don't quote me on that because we have to assess that when we see you. But if we did one syringe, it would be $700. I have a question, does this last longer than Botox? This is not Botox, but this is a hyaluronic acid filler. So Botox is a neuromodulator, does something completely different. Botox is stopping muscle movement to make a line not form, whereas this is something where there's already a line there, and we're trying to fill the line a little teeny bit so that it doesn't look as visible. Botox, just so we're on timing, lasts 3 months. These fillers are reported to last up to 15 months. Go down a little bit. Okay, I'll try to go. So I had a question, what's the difference between the 3 RHAs? So there is RHA 2, 3, and 4, and they work in different areas of the face. So RHA is a little bit thinner. We might use that in areas of the face, such as say the smile lines here, whereas the RHA 4 has a little bit more of a punch. Those who have a little bit of a deeper fold, who have a little bit thicker skin, we might use the RHA 4 on them. So again, it's really going to be dependent upon the area of the fascia that you're looking to work on, your age, and what your wrinkles look like at the time. And that determination will be made by your provider when they see you. Someone said that it looks painful. Was there an anesthetic used? There was. We used a topical anesthetic. We also used a cannula, which actually cuts down on the pain pretty significantly. Cannula is just a blunt tip. So I don't know if you saw during the video, I used a needle to make the initial pilot hole. And then I used the cannula, which is a blunt tip, to get the actual filler into the skin. So as well, our model used Pronox, which is laughing gas, to make it a little bit more tolerable. I would say that I can't make the treatments be zero painless, but I think with the combination of topical numbing cream and the use of a cannula, they're actually pretty simple. Can you use RHA under the eyes? You absolutely can. So again, but the type of RHA that we would use would be dependent upon you when we see you, and that determination be made in person. Technically, I would say though, normally I'm using RHA 2 under the eyes. Can this filler be used for lips? Absolutely as well. Again, it's going to depend on what your goals are. How big do you want them to be? So 2, 3, or 4. Someone said that they really thought this was awesome to watch. They liked the results. Thank you. I actually liked doing the video, and our model absolutely loved the results. Was it one syringe that we used for the treatment demo? Yes, we used just one syringe for that model. And fortunately, our model is pretty, symmetrical. She's young. So we were pretty even on each side as far as the amounts that we used. Someone asked a question, has this been tested with the vaccines for side effects? So I'm assuming you're referring to the COVID vaccines. None of the fillers per se have been tested individually for the COVID vaccine. I think what you're referring to were some of the reports for swelling afterwards from receiving hyaluronic acid fillers. And those were actually just adverse events that were seen in general from getting fillers. It wasn't to a particular filler. So technically any hyaluronic acid filler that a person receives, if they also receive the COVID vaccine within a 2-week period, they can get some swelling in the areas where the filler was injected. However, I do want to report from everything that I've seen, the incidence of having filler-related issues from the COVID vaccine is about 0.0009, which is extremely low. And those adverse events, which were swelling in the areas where the fillers were injected, were resolved with just over-the-counter Benadryl. Okay. How long does the filler last? Up to 15 months, as I had mentioned earlier. Can this product use between the eyebrows? So, like they use Botox. So my personal opinion is I don't like doing fillers in general in this area between the eyebrows because it's a very high risk area. It's an area where there's a single blood supply that goes to the eyes through this area, and if the vessel's occluded, that could lead to a significant problem, blindness potentially. The other concern that we would have is that the fillers in this area sometimes not occluding the vessel, but they can cause pressure upon the vessel and still leads to some vision issues. So I personally won't inject filler in this area. Is the product only for the nasolabial folds? No, the product can be used in any area, again, where you have a dynamic wrinkle that occurs. So if you're making a facial expression, smiling, and you see wrinkles around the crow's feet, you can use it there. If you see wrinkles in this area over here, you can use it there. Again, it's any area of your face where you see a wrinkle that's dynamic related to muscle movement. Where in the face can this be used besides the parentheses? Again, as I had just mentioned in the previous question, any area where you see a dynamic wrinkle. So some of the common areas where I use it, nasolabial folds, marionette lines, smile lines, these lines that occur in this area over here, crow's feet area. These are areas where most of my patients will commonly ask, hey, I'm seeing these lines, I want them to go away. I prefer this product in those types of areas because I've used some of the other ones. I'm not saying that they're bad products at all. They tend to sometimes, though, particularly in the smile lines in this area here, they can be visible when a person makes the movement because they're a little bit stiffer. So I haven't had that issue with the RHA products because they were specifically designed to look natural with expression. Let's see. So someone had asked, they had had radius in their nasolabial lines. Will this interfere how it is absorbed? So the radius won't interfere how the product is absorbed. I think that what you're asking, if you already have the radius there, will the radius interfere how this product is being absorbed? And the answer would be no. You can layer the products if you need to. It's been asked, can this be used on the neck to smooth out the wrinkles? So I'll again get to, this is a product best designed for areas where we have dynamic lines and wrinkles. You can absolutely use it on the wrinkles in the neck, there's no question about it. But it really depends on the wrinkles you're referring to. So some people will refer to these necklace lines going across, which are really more folds, and it can be used there as well. If you're seeing lines that are forming when you make movements like that, that may be more of a neuromodulator or Botox issue. So it really depends on the wrinkles on the neck that you're referring to. But I would say, from what I'm interpreting from your question, the answer would be yes. So how does this compare to a collagen generating product? So these are different than collagen or biostimulators, as we call them, which are products that are designed, they implant some type of compound that's going to stimulate your body to make its own natural collagen. These products are not collagen, they're hyaluronic acid, which we normally have in our skin, but they're doing different things. So these products are immediate. What you see that day is what you get, minus some swelling, whereas the collagen stimulating products need a few months to exert their effect. So they just work in different ways. One which is implanting a gel, which is going to go away over time, and another one which is implanting some type of compound that your body will sense and then begin to form collagen around those little particles that are in that compound. So they work a little bit differently. I had a question, how long do the results last compared to regular fillers? So regular fillers, I guess what you're referring to, are going to be Juvederm and Restylane. They have multiple products in their line, and they can really last anywhere from 6 months to 2 years, depending on which of the Restylane or Juvederm products that you're using. The RHA products are all designed to last up to 15 months. So I hope that answered your question. Can it lift a drooping eyebrow? The answer would be yes. And the way that I approach a drooping eyebrow, it really depends on whether or not that's going to be natural to you or it was caused by something else. If it was caused by Botox, that probably wouldn't be the best thing to use. If it's an eyebrow that you're just seeing from aging that's drooping down, I commonly use fillers in the lateral portion of the brow over here, just implanting a little bit of the product right on the edge of the brow, and it helps give a little bit of a volume raise. So yes, this can be used to raise the eyebrows. Can I get service done while nursing is a question. Unfortunately, we will not inject any patients with any type of neuromodulator or Botox while pregnant or breastfeeding or nursing a baby, unfortunately, sorry. A question I've got, smile wrinkles outside of where my nasolabial folds are, would you be able to inject those? If you're referring to these lines over here, it's one of my favorite areas to inject with this product. So the answer would be yes. Is there any bruising after? Unfortunately, with any type of procedure where we're injecting needles into your face, whether it be a neuromodulator, Botox, Dysport, or any type of Juvederm, RHA, or Restylane, there's always a potential for bruising. Our suggestion would be that you stop any alcohol, particularly red wine, ibuprofen, or Aleve, any type of blood thinner at least a week beforehand, and preempt with arnica tablets a week beforehand. That should significantly cut your risk of bruising down. As you saw in the video as well, I use cannulas, and 99% of the time I use injections, and I always have my little green light, my little AccuVein around with me to minimize bruising. Okay. How long is the recovery? The recovery is going to be the same as with any other type of filler. So you may be a little bit swollen for 48 hours. So I tell all of my patients, if you're going to get a filler done, that's not the night you want to go on a date, or have a party with friends, or have any alcohol. So I would plan on at least 48 hours for swelling to go down, and then potentially if you do bruises could be anywhere from 3 days to 2 weeks, depending on the person. So yeah, I had a question, how long does the RHA last for the lip injections? Will it be 15 months? Yes, so 15 months in any area of the face, and the price is $700 per syringe, no matter which area of the face that we use it. So I had a question that someone's booked for KISS, and they want to know the difference between KISS and RHA filler in the lips. So, you know, actually, there's really not too much of a difference. My opinion is going to be, I like KISS. I don't think it's a bad product. I like the way it looks, very natural. The only issue I might have with it is that I don't see it lasting as long as I'd like it to. So it was reported by the company that makes it, Galderma, to last up to a year. And there are some patients that it does last up to a year, but there are unfortunately a good number of patients where I see it going away 3, 4, 5 months. So I haven't seen that yet with RHA. So, you know, truthfully, I've been using RHA for about a year now. And I've seen it, you know, so far so good. It seems to be holding up for as long as it's been, you know, reported to. Let's see here. Yes, you had a question. Can you split the syringe up between the eyes and the nasolabial folds? I assume you're referring to the under eyes. Yes, you can. Now, it depends though, because the under eye filler that we would use is more likely to be a 2, and I would probably use a 3 or 4 in the fold. So it would really depend on the consultation that we would have with you to see if we would, you know, be able to use the filler interchangeably. We're going to have a few more questions coming in, okay, and then we're going to have to end the question and answer soon. Let's see here. Someone said they have deep dimples, and it makes it look like they have wrinkle folds when they smile. And they would ask, can this product be used to make dimples look like dimples and not wrinkle folds? You know, that's going to be a tough one to answer. Me personally, I don't ever want to get rid of anybody's dimples, because I think they're great characteristics of a person's face. However, I would say, you know, what the best way to answer that question would be to really see you in person to see exactly what you're referring to, because I don't want to, like I say, get rid of your dimple. But if you think it's a significant fold that's occurring, then sure, we can address it. But my suggestion, don't get rid of your dimples, okay? Is this more cost effective in comparison with other fillers, or about the same? So, you know, it really depends on the filler you're referring to, because some of our fillers are priced the same, some are priced a little bit less, some are priced a little bit more. And again, it's going to be dependent upon the area of your face where you're going to do it. So it really depends on the area of the face that you're going to do it in and what your goal is. So I'm going to say, for the most part, they're going to be comparable on average, okay? Let's see here. I always see, let's see, if they get Botox for their crow's feet. Okay. So they're saying they get Botox for their crow's feet, and they want to know if there's going to be a difference between this and the Botox that they get. So again, they're doing different things. So the Botox is going to be stopping the muscle movement that's going to be creating that wrinkle, whereas the RHA is not going to stop the muscle movement, okay? It's just going to help the wrinkle look less apparent when you make the muscle movement. You'll still be able to make the full muscle movement if you have the RHA filler. I had a question, how many syringes will you need under the eye? It really depends on each person. Personally, as an injector, I don't do any more than 1 syringe at a time under the eye. That's a very challenging area, okay? So we can always add in more, but I don't want to do overkill. It's a pain in the butt to take it out. So 1 syringe at a time under the eye, okay? We had a question, do we accept care credit? Yes, we do. Yeah, we do have a special offer, just as a reminder for those that are attending. It's buy 2 syringes, get 1 free, okay? And then you will receive a text at the end of this question and answer. Just reply yes to the text, and someone will reach out to you to schedule an appointment. All right, everybody, that's our question and answer for tonight. I really appreciate everybody for joining. Stay safe. Have a good night.